Hi, we're the new junior faculty at the University of Carefree Living. I'm Chris.
And I'm Johnny.
Today we're going to present the concept for selecting appropriate antiarrhythmic therapy in patients with symptomatic, recurrent, paroxysmal, or persistent atrial fibrillation.
And so in patients with recurrent paroxysmal atrial fibrillation, those with minimal or no symptoms are placed on anticoagulant and rate control therapy as needed. Now in those with disabling symptoms in atrial fibrillation are placed on anticoagulant and rate control as needed and antiarrhythmic drug therapy. Now if that fails, ablation is to be considered.
For those patients with recurrent persistent atrial fibrillation with minimum to no symptoms, anticoagulation and rate control as needed are given, but no antiarrhythmic drug therapy. For those with disabling symptoms, anticoagulation and rate control are given, as well as antiarrhythmic drug therapy and electrical cardioversion as needed. When you're on those, continue anticoagulation as needed and therapy to maintain sinus rhythm. Consider ablation for those severely symptomatic recurrent atrial fibrillation, failure of antiarrhythmic drug therapy. For those patients with permanent atrial fibrillation, give them anticoagulation and rate control as needed, but no antiarrhythmic drug therapy.
Okay, so let's test your knowledge. Which of the following patients would be candidates to receive antiarrhythmic therapy?
For option A, recurrent persistent atrial fibrillation with minimum or no symptoms, that one cannot be correct because they don't have disabling symptoms. For B, permanent atrial fibrillation would not be correct because it would be no use giving them an antiarrhythmic drug therapy. For C, recurrent paroxysmal atrial fibrillation with disabling symptoms is correct because they have the disabling symptoms. D, none of the above is incorrect because C is the right answer. Thank you very much.
Bye-bye.